Most people, when you talk to them, you're looking in their eyes. Some people notice that people keep staring at their mouth and they say, my mouth looks like I've been smoking for 100 years. What can I do? I've never smoked a day in my life. It must be my grandmother, it must be my great-grandmother. And I tell them, you're right. You cannot fight the genetics of it. It just doesn't matter. Age is age and it works on a background of genetics. We have the tools that will get that area to look as good as it possibly can and maintain itself while you continue to age. One of the most interesting things that I see is that people that have had plastic surgery on their face, their eyes, their cheeks, they come in and see me, but the most glaring fault is the mouth, because the other plastic surgery doesn't deal with the mouth. So they look out of place, they don't look balanced, they don't look right. For a plastic surgeon, I think that the area around the mouth is the most difficult area to deal with, because the mouth doesn't react to aging the same way that the rest of the face does. The jawline shrinks around the mouth, and that whole area becomes a depressed area. This triangle involves the upper lip, the lower lip. It involves the white portion of the lip and the red portion, which we call the vermilion lip. So what we figured is this: how do we smooth over the irregularities around the mouth, and how do we fill the depressions that people get around the mouth? I do it by utilizing your body's own fat, and that fat I steal from areas that you hate, and I put it in areas that need it. And we take it out very gently and put it in a centrifuge. And then the centrifuge, which is sterile, spins the fat and removes the fat from the oily portion, which usually is not what we want, as well as the fluid portion, which is the material we inject initially to take the fat out. That purified fat is then taken, put into tiny little syringes, and then through one or two little pokes, I put it around the mouth and in the skin as if I was sculpting a facial bust and just doing it in clay. So it's an artistic endeavor using biological material that has permanency. There is nothing else that is like that. But I also use a hybrid type of laser where I use a very fine painting mode to get just the wrinkles, and then I use a more diffuse mode behind it to kind of soften the area of the canvas. Now usually the areas around the mouth can easily be anesthetized the way you would in a dental office by putting a little local anesthetic around the mouth. And then we use a little local in the thighs or wherever we're stealing the fat from. So most of these procedures are really done under a local anesthetic. They're relatively simple. And the fat is taken under local, and then it is purified, and then it is put in the mouth, and you really never feel it. The same way for the laser portion. There is no pain involved in this. It's very easy for the patients to deal with.